Jones was 59 years old and had been fighting fires and riding ambulances as a professional and volunteer since he was 16, according to his colleagues. His funeral was yesterday. He was one of more than 1,500 people who died of COVID in Maryland in January, a pandemic record.
Bobby was one of my brothers, and he's going to be greatly missed.
Kenneth Hyde is president of the Reese Volunteer Fire Company in Carroll County, Maryland, where Bobby was volunteering during retirement. Hyde said Bobby was exposed while running ambulance calls.
Bobby had 2 of them in the last week he worked, and that's probably the scariest thing I've been through. I thought I would be the one to catch it.
Bobby Jones was a casualty of the Omicron surge, Hyde said, a surge that pushed Maryland hospitals to the breaking point, according to Bob Atlas of the Maryland Hospital Association, reacting today to the record number of deaths in the state.
It's really tragic, and our frontline caregivers are really saddened. Our hospitalizations are down from the peak that we had just a couple of weeks ago. We're hopeful, but the burden on our hospitals is still tremendous. We have a lot of people who need care for things other than COVID. So every bed that frees up from a COVID patient discharged is immediately filled with patient with something other than COVID.
Atlas said nursing vacancies are up 50% since August because so many have quit under the stress. Back at Bobby Jones's morning firehouse.
We have seen the calls drop off, so that's good. We seen the call surge in December and January through the roof. December was through the roof. Bobby's actually the second paramedic we have work here that has COVID, and Bobby succumbed. The other guy is doing better, so that's a good sign for us.
Bobby Jones's vaccination status has not been made public, but 80% of the people who died during this record-setting January surge in Maryland had not been fully vaccinated, according to state figures. Scott Broom, WUSA 9.